So we're going to start talking about heart failure, um, which, as I said before, isn't it's not heart arrest or cardiac arrest. It's where the heart begins to get weak. The heart muscle is weakening, and you're getting reduced cardiac output from the heart. So this term dilated cardiomyopathy, it's just how it's just exactly the sentence. So dilated means that the chambers are becoming dilated because they're weakening and they're not able to contract as well. Cardiomyopathy is it's a muscle problem, right? So the muscle is stretching more and more because it's becoming weak, and the blood continually comes into the chamber, so it's stretching the chamber more and more. So it's a floppy, weak heart. So because the muscle is weakened, it has a reduction in the ability to pump blood into the systemic circulation, the aorta. We're typically referring to the left ventricle as usual because that's the main pumping chamber to get blood into the systemic circulation. And as it enlarges, well, we can see it on chest X-ray that you have cardiac enlargement, which is typically an indication of heart failure. That the chamber the left ventricle just cannot move all the blood forward any longer. So what causes this? So most commonly, atherosclerosis of the coronary arteries, which leads to heart attacks, harms the myocardial muscle. It weakens the muscle. So because we know that infarctions, heart attacks, that muscle doesn't grow back. You just have to continue with the muscle that's remaining. So it's weaker. The pump is much weaker. And over time, this leads to a dilated heart, a dilated left ventricle, because of its inability to pump the blood. And as it dilates, the chambers get thinner and thinner. The muscle is being stretched more and more as the chamber enlarges. And there's something called Starling's law, and you may have learned it in anatomy and physiology, is where the muscle, the actin and myosin should be overlapping each other. And as the muscle gets stretched more and more, the actin and myosin don't overlap anymore. And this is more of a theoretical idea, Starling's law, but because the actin and myosin don't overlap anymore, the contraction is much weaker because you need that overlap to provide the myocytes, the muscles of the heart, to contract. And this leads to a dilated, enlarged left ventricle in particular. And this is really the beginning of heart failure because the pump is now weakening. And as I said, heart attacks are the most common. But if you remember, anything that damages the heart permanently will lead to the same problem of heart failure. So if you had a myopathy, so a cardiomyopathy from some kind of muscle disease of the heart, like you had myocarditis from a viral infection, and it permanently weakened the heart muscle, then this will lead to heart failure as well. So, but by far the most common is repeated heart attacks that that lead to a weakened left ventricle, that then lead to a dilated left ventricle, and then leads to heart failure. So this slide is on heart failure. And when I think of heart failure, let's try and think of it in terms of left-sided heart failure, so the left side of the heart, and right-sided heart failure. Left or right-sided heart failure will give you different signs and symptoms, and you'll see that when we go over them. Just keep in mind that heart failure as a whole is a syndrome, it's not a disease. Many diseases can lead to the syndrome of heart failure where the heart just can't pump any longer to provide normal cardiac output. So it's not that you're dead, it's just that the heart is gradually failing from reduced cardiac output. So left ventricular failure is the one that we're typically most concerned with. That is the one that the left ventricle is the chamber that's having to pump against high pressures in the aorta. So if the left ventricle fails or is failing, everything's going to back up into the left atrium and then into the lungs, causing congestion of fluid in the lungs. So left ventricular failure is typically the most common chamber involved. Now, any disease that harms the muscle, the myocardium of the heart, it can lead to heart failure. So whether you have multiple heart attacks, myocarditis, which is typically a viral infection that has damaged the myocardium permanently, plus a whole bunch of other processes that damages the muscle permanently. What about long-standing chronic hypertension? Well, that's a chronic stress on the left ventricle, having to pump at high pressures to open up the aortic valve to allow the blood to get into the systemic circulation is going to put a chronic stress on the left ventricle. And the left ventricle will gradually weaken over the span of years and lead to heart failure. Coronary artery disease, well, the blocked arteries don't cause heart failure, but what do the blocked arteries do? They lead to heart attacks, which damages the muscle. Valve diseases, leaky valves in the aortic valve or the mitral valve, or tight stenotic valves. Well, that's going to lead to heart failure because the blood that you're pumping out is either leaking back into the left ventricle or it's leaking into the left atrium when you're pumping because it's regurgitating. So we'll get into stenosis and regurgitation of leaky valves and how that puts a chronic stress on the heart and can lead to heart failure. And we're going to get into the list of symptoms and signs that left ventricular failure cause and a list of what right ventricular failure cause, and I think it'll make sense. So just as a whole right now, we're thinking of heart failure as my pump is weak, the muscle is weak, and I just can't continue with forward flow of blood, so it's going to back up. And depending on which chamber, the left ventricle or the right chamber, will decide on where it's going to back up. And just remember, heart failure is not cardiac arrest or death. It's a syndrome where your cardiac output is reducing over time, and it can lead to significant disability and death, where the heart just decides it can't pump any longer at all, despite medications and other options that we provide to patients. So let's look at some conditions and diseases that lead to heart failure, the weakening of the heart to maintain cardiac output. So the first one is high blood pressure. So if you can imagine the left ventricle having to pump against high blood pressure, it is over years going to cause damage and gradual weakening of the left ventricle because it's constantly having to pump against this high pressure in the systemic circulation. Let's go clockwise here. So lung problems. So anything that makes the pressures high in the pulmonary system will lead to increased strain
an increased chance of right heart failure. So COPD, chronic bronchitis, anything that's causing high pulmonary artery pressures, pulmonary emboli that have blocked all the smaller arterial vessels going to the lung. That's going to cause increased pulmonary pressure, which will then lead to right heart failure, because the poor right heart is having to pump against high pressures to move blood to the lungs. So why does COPD cause high pressures in the vessels of the lungs? Well, you can imagine that if there's low oxygen levels in the alveoli, which is seen in certain lung diseases, the capillaries, the blood vessels, don't want to go to those alveoli, so they vasoconstrict. Because if there's no oxygen there, there's no sense in having all these little capillaries going there. So they automatically vasoconstrict, and that will lead to higher pulmonary pressures. So lung disease, or any conditions that cause fibrosis of the lungs, will also damage those little vessels in the lungs. So there'll be fewer vessels, and that will also raise pulmonary artery pressure, which is going to put strain on the right ventricle and finally lead to right ventricular heart failure. What about other medical conditions? So anemia is low hemoglobin levels in the bloodstream. That means less oxygen carrying capacity in the blood, and that means less oxygen delivery to its organs, including the heart. And that will put a strain on the heart, because the heart is continually pumping, and so it requires high oxygen demands. So if you're anemic, you can't deliver as much oxygen, and that can lead to heart failure. What about kidney disease? Well, kidney disease often comes with hypertension. And hypertension, as we know, is a risk factor for heart failure. Diabetes, that's a risk factor not only for developing hypertension from blocked little arterioles in the circulation, but also it's a risk factor for coronary artery disease, which will lead or can lead to heart attacks and damage the myocardium, weakens the myocardium, so that can lead to heart failure. Obesity, well, obesity is a risk factor for diabetes, for hypertension, for kidney disease. So obesity in itself is a risk factor for many other diseases that lead to heart failure. Thyroid disorders, that's usually referring to hyperthyroidism or Graves' disease. And that's where you have too much circulating thyroid hormone. And the thyroid hormone is a regulator of metabolism in the body. So when you have too much thyroid hormone, it's making your entire system work harder. Like all the cells are metabolizing faster. So the heart's going to have to work harder, because all the cells in the body are metabolizing at a much faster rate. So it's working harder to supply blood to all these cells. So that can put you into congestive heart failure or heart failure, just by the overall increased metabolism of the body. What about lifestyles? So failure to take preventative medications. So that's usually referring to, say, aspirin. If you have coronary artery disease and you're not taking aspirin, it's a higher risk that you could get heart attacks. That can lead to heart failure. Cholesterol medications. So if you believe that cholesterol medications that lower your overall cholesterol will lower your risk of heart disease, and coronary artery disease, then not taking those medications can lead you to develop heart failure because you're going to clog your coronary arteries faster. What about diet? So excessive salt. Excessive salt is linked to hypertension, which is a risk factor for heart failure. Alcohol is a direct toxin to the heart, so it's going to actually pickle the myocardium. It's going to harm the heart muscle itself. Drug abuse. Many drugs of abuse are hard on the heart. Let's use cocaine as an example. Cocaine is a sympathomimetic. It makes your heart contract harder. It makes it beat faster. It causes hypertension. So it puts a real stress on the heart. It vasoconstricts your coronary arteries, like the rest of the arteries in the whole body. It vasoconstricts them, so less blood will be going to feed the heart because of the cocaine. So heart attacks from cocaine are a real thing. They can definitely happen in young people that are using cocaine. Just like strokes are a risk factor when you're using cocaine because of the hypertension. Okay, so on the left there we have heart problems. So valve defects. So if you have a leaky valve called a regurgitating valve, or a very tight narrowed valve called a stenotic valve, that's going to make it difficult for blood to flow from one chamber to the next chamber. So let's say, for example, you have what's called aortic stenosis, which is a very tight aortic valve. So the left ventricle is contracting, but it can't force all this blood out because the aortic valve is stenotic. It's narrowed and tight. So that puts a real strain on the left ventricle that over time can lead it to finally fail and just weaken. What if the mitral valve has regurgitation, mitral regurgitation? Well, that is every time the heart beats, some of the blood leaks back into the left atrium. And that's going to be a stress on the heart because it's going to have to repump the blood that it leaked into the left atrium. It's just going to have to come back into the ventricle and then be pumped again. So the heart is working extra hard with valve defects. Rhythm disorders. If you have a very, very fast heart rate, such as in a condition called ventricular tachycardia, where you might have a heart rate of 250. Well, there's not enough time for the heart to fill, for the ventricles to fill with blood. So you will go into heart failure because there's not enough time to fill with blood and pump the blood and then refill with blood. So you can go, that will lead to heart failure based on the inability to beat that fast. Heart muscle defects like myocarditis, that's basically just damaged heart muscle from, say, a virus. So myocarditis is commonly caused by a virus. It's called viral myocarditis. So that just leads to a weakened muscle, and a weakened muscle leads to heart failure. Coronary artery disease, we've seen coronary artery disease leads to blocked coronary arteries that then leads to heart attacks, MIs, and that weakens the myocardium, which makes it difficult to maintain cardiac output. So remember, heart failure doesn't mean that the heart has stopped working. It just means that it's not pumping normally to maintain a normal cardiac output. And because of that, you're going to gradually get symptoms because the blood that can't leave, say, the left ventricle is going to gradually back up into the left atrium and then into the lungs. And we'll get to that in more detail. So we're just going to go briefly into heart failure concepts here. So we've already spoken about the idea of left-sided heart failure. So we'll say left ventricular failure and right ventricular failure. Because the atriums don't really come into play very much when we're talking about heart failure. They're very thin muscle chambers. They contract a bit, but they're not responsible for pumping the blood either to the lungs, such as the right ventricle, or into the aorta in the case of the left ventricle. So if I say right-sided failure, it's right ventricular failure. If I say left-sided failure, it's left ventricular failure. So if the left ventricle fails, what's going to happen? Well, cardiac output is going to drop. It's going to be reduced. The forward flow of blood is going to be reduced. So the blood will gradually back up from where it came from. So it'll back up into the left atrium, and then it'll back up into the pulmonary veins and the pulmonary arteries. And then as the pressure in those blood vessels in the lungs increases, the hydrostatic pressure in those vessels is higher. So you get leakage of fluid all around the alveoli called interstitial fluid. So you're getting an increase in interstitial fluid within the lungs, and that will lead to pulmonary congestion or interstitial edema, pulmonary interstitial edema. Now, right heart failure. So basically, left heart failure is you're backing up fluid, and the next organ to be hit are the lungs with congestion of fluid into them. Right heart failure leads to a reduced forward flow to the lungs of the blood, and it leads to backup of the blood into the venous system. So into the right atrium, superior vena cava, inferior vena cava. So there's going to be increased venous pressure backwards with right heart failure. And you can just imagine if you have increased right-sided pressures in your veins, well, that's where you're going to get swollen legs. You're going to have distended veins in your neck. You're going to have a swollen liver because the blood can't drain back into the inferior vena cava. You're going to have swollen veins all around the intestines because the blood, again, can't flow to the liver to get back to the heart. So there's a backup to the venous system in right failure, in right-sided heart failure. In left-sided heart failure, the backup hits the lungs first. Now, the most common cause, and this could be a question on a test in ATI or wherever, the most common cause of right heart failure is left-sided heart failure. So why is that? So left-sided heart failure is not an uncommon condition because of heart attacks, because of high blood pressure, because of diabetes. So when your left ventricle fails and it backs up, well, where's all that fluid gonna go? It's gonna end up in the interstitial space, the interstitial fluid around all the alveoli, and it's gonna put increased pressure in the venous system and the arterial system of the lungs because there's reduced forward flow since the cardiac output from the left ventricle is reduced. So now the right ventricle is wanting to pump blood forward, but it can't because there's already a lot of blood in the lungs, and the hydrostatic pressure in the pulmonary system is high. So the poor the poor right ventricle is having to pump against high pulmonary artery pressures, and that will gradually lead to right ventricular heart failure. And then all the symptoms and signs of right ventricular heart failure will also happen, all because the initial problem was left ventricular failure. So let's go to the next one. It's not this next concept is not as important as left versus right. Systolic heart failure versus diastolic heart failure. And when we're talking about this one, it's typically we're just talking about the left ventricle normally. So systolic heart failure is really, if you think of a weak muscle of the heart. So it goes to contract during systole, and the muscle is just weak, either from multiple heart attacks or some kind of myocardial disease of the left ventricle, or leaky valves of the mitral or aortic valve, and it's just the left ventricle is just tiring. It's weakened. So that's systolic heart failure, and that's the most common of systolic versus diastolic. So systolic left ventricular failure is basically the same as saying left ventricular failure. Diastolic heart failure is typically caused by high blood pressure, high arterial blood pressure. And the poor left ventricle is pumping and pumping and pumping against this high blood pressure for years, and it gets thicker because the left ventricle says, you know what, if I have to pump against higher pressures, I'm going to get stronger. I'm going to get thicker. And what finally happens is as the left ventricular muscle gets thicker, the chamber gets smaller. And now it's getting more and more difficult to fill with blood from the left atrium because the chamber is smaller. So the muscle is thickened and strong. It can still pump, but the chamber is small and it can't accept the blood from the left atrium. So there's reduced cardiac output from the left ventricle because it's not filling enough with each relaxation, with each diastole. So we call that diastolic heart failure. So if we were to test that muscle, it would still be able to contract well, unlike systolic heart failure. But it's so thickened that the chamber has become small and unable to fill with blood. So that's the concept between diastolic heart failure. Now, it still leads to heart failure, meaning the left ventricle is still backing up blood to the left atrium and to the lungs. And the reason for it is it just can't accept enough blood because of the thickened myocardium, which is different than the systolic heart failure, where it can accept the blood, but it's so weak and floppy that it just can't pump it out.